Hi friends, let's talk about when to get angiography or left heart catheterization done. Let's first understand what is angiography. This is a diagnostic test that we use to diagnose whether or not you have heart blockages, and if you do, how many blood vessels have the blockages in your heart. So, when to get this test done? It depends on your symptoms and the diagnosis. If you've had a heart attack in which you've had a chest pain, your blood tests have proven that there is damage to your heart, and the electrocardiogram or the ECG that was obtained also shows that you have damage to your heart or a heart attack, then we strongly recommend that you undergo angiography to see if you have a blockage, and if yes, this can be fixed at the same time during the procedure in most cases. Number 2, we recommend angiography directly if you have unstable angina. Now, what is unstable angina? It is a situation in which you do not have blood tests supportive of damage to your heart, but you do have ECG changes or electrocardiogram changes that support that you have ongoing possibility of reduced blood supply to your heart. In this situation, we also recommend that you undergo angiography. A third situation in which we recommend angiography directly would be a situation like an abnormal heart rhythm, something like a ventricular arrhythmia, in which the lower chambers of your heart beat at a very rapid pace, which could be dangerous, and it could be the first sign of a heart blockage as well. So in cases of a heart attack, unstable angina, or in cases of an abnormally dangerous rhythm, we recommend that you undergo angiography as soon as possible to diagnose a blockage if there is one and fix it in the best way possible without wasting any time. Now let's talk about stable angina, or a situation in which you only have chest pain when you exercise or do some kind of exertion, or you have emotional stress. But when you are at rest and relaxed, you do not have chest pain. We call this stable angina, and this angina is quite predictable. In these cases, when you have stable angina, we usually opt for a stress test first. A stress test could look like you walking on the treadmill as we monitor your electrocardiogram, or you could be walking on a treadmill and we could get echocardiogram or ultrasound images of your heart. Or as a third option, we could be doing what is called a nuclear stress test, in which basically we take pictures of your heart after stressing your heart either with exercise or certain medications, and see whether there is any part of the heart that is not getting enough blood supply. We opt for a stress test in stable angina because it is a non-invasive test with lower risk profile and can be extremely useful as well. Now, depending on the results of the stress test, if we see features that are high risk, that suggest to us that you have multiple blockages in multiple blood vessels of your heart, or you have a more proximal or a blockage in a major blood vessel, then we may recommend proceeding with an angiogram directly. However, if the stress test suggests that you have a low risk finding, meaning that you could have a small blockage in the heart, but it is not in a major blood vessel and it is likely to be only a single blood vessel, then we may recommend that you start treatment with medications like aspirin and cholesterol lowering medications right away, and we may not need to proceed with an angiogram unless you have symptoms despite medical therapy or despite taking medications. Another situation in which we may proceed after a stress test directly to angiogram would be if the stress test was equivocal, it was non-diagnostic due to certain limitations of the testing, and if you still continue to have symptoms and we are unsure why you are having symptoms and our suspicion for you to have blockages in the blood vessels of your heart is significant, then we may still suggest to proceed with an angiogram despite having a non-diagnostic, in some cases a negative stress test as well. So as you have probably noticed that the selection of angiogram versus test really depends on a lot of factors, and it requires a detailed history, physical examination, and review of the medical chart and talking to the patient to decide what test is best suitable for you. I hope this video was helpful, and if you have any questions, please feel free to comment. Thank you.